Hey guys, this is Dr. Omkar, physiotherapist from Mumbai, and welcome to another episode of PhysioFeel. Feel the physiotherapy. Today, I will be talking about the first branch of physiotherapy, that is, physiotherapy in orthopedic conditions. Before I start, I would like to thank you all for liking my previous episodes. I received a few questions in my previous episodes, and thus I want to start today's episode by answering one of them. So the question was, can physiotherapy helps in preventing diabetes? Well, there are basically two types of diabetes, type 1 and type 2. Type 1 is congenital or insulin dependent diabetes mellitus, and type 2 is adult onset or non-insulin dependent diabetes mellitus. As the name suggests, type 1 diabetes is juvenile diabetes, and hence it is detected at early stages of life or even at the time of birth. It is very difficult to prevent that kind of diabetes mellitus. But type 2, definitely. Say for example, if your family have history of diabetes mellitus, you are at a high risk of getting diabetes. But if you take proper care, you can definitely prevent diabetes mellitus. How? I will tell you. So prevention can be done in three ways. 1. Change in the lifestyle. 2. Nutritional change. And 3. Exercises. Now let's talk about the change in lifestyle. As I discussed in my previous episodes, that we have adapted a sedentary lifestyle. We use maximum gadgets and tools that reduces our physical work. In one way, it is good. It saves our time. But what about body? So firstly, we should change our lifestyle and help ourselves. Now let's talk about the nutritional change. Nowadays, frequency of junk food eating in our diet has increased. I'm not saying you have to completely avoid it, but we have to minimize it and have a healthy food as a part of your daily diet. We have to consume essential fats, vitamins, carbohydrates daily in our diet along with your exercises. Now let's talk about exercising. Initially, there is absolutely no requirement of going for heavy workouts. But yes, we can start by simple walking for 15 minutes or half an hour, and gradually can increase to 45 minutes and 1 hour. This will help in regulating the metabolism, your insulin level and your blood sugar level. I am going to talk about this in detail when I discuss physiotherapy in diabetes mellitus. As of now, I have explained it to you in brief, the 3 preventive measures. If you want to know more about it, please click the link that I have mentioned in description. So now let's talk about the first branch of physiotherapy, that is physiotherapy in orthopedic conditions. Now what are orthopedic conditions? So whenever there is involvement of any bone, ligament, muscle, tendon or any soft tissue in any injury or disorders, that will be considered as orthopedic condition. Now these are some generalized orthopedic conditions which I am going to tell you in which physiotherapy works. Fracture, pre and post orthopedic surgery, generalized or localized pain, all stages of ligament injury, all stages of muscle injury, osteoarthritis, rheumatoid arthritis, fitness, dislocation of joint, subluxation of joint, amputation, sports injuries, repetitive strain injuries. In my next episodes, I will be telling you about the shoulder joint and the conditions that can be prevented and can be treated by the help of physiotherapy. So guys, stay tuned and subscribe to this channel for further updates. If you feel your friends and family should know more about physiotherapy, then do not forget to share this episode because it's all about PhysioFeel. Before we end, I just want to tell you one thing friends, that our community is little careless and ignorant. We avoid our pain for different reasons and then land up into bigger problems. So prevent those complications by early diagnosis and prevention techniques which are used in physiotherapy. Goodbye, stay healthy.